Then this is the content of the posterior part of the submandibular region or the triangle. Now which triangles left?
The muscular.
Muscular and the carotid triangle. Okay, now we discuss about the carotid triangle, how the carotid triangle is formed. Carotid triangle, if you cover like this, okay, superior, inferior and the posterior boundary. Superior, and I will cover this one in the proper place, then you understand. Because this only the few fibers of the muscle. Because few fibers of the superior belly, it's crossing like this deep to the sternocleidomastoid. This is we call the omohyoid. In other also the some fibers are there. Okay, so this triangle, one here, superior belly, and this one. So how we discuss about this one? Superiorly it is bounded by the posterior belly of the digastric. So look this triangle. Okay, superiorly it is bounded by the this gland will go inside. It is like that. Okay, like that triangle. This triangle we call as the carotid triangle. So superiorly by posterior belly of the digastric and the stylohyoid muscle. Okay, and inferiorly by the superior like this. Superior belly of the omohyoid, posteriorly by anterior border of the sternocleidomastoid. So this triangle we call as the carotid triangle. Okay, what are the floor of the carotid triangle? Floor of the carotid triangle, the muscles, yeah, because it's the infrahyoid muscle, sternothyroid, and this thyroid, infrahyoid muscles. Okay, and then what are the contents? Yeah, carotid, yeah, carotid sheath, in which the carotid sheath, these all structures: common carotid artery, and then vagus nerve, internal jugular vein, and what are the structures? Common carotid artery then divide into the internal carotid artery, external carotid artery, okay, and then the hypoglossal nerve, okay, hypoglossal nerve and its descending branch of the hypoglossal nerve, accessory nerve, this all structure here which are the contents of the digastric triangle. So accessory nerve, hypoglossal nerve, common carotid artery, division of the common carotid artery, internal and the external carotid artery, okay, internal jugular vein, vagus nerve, descending branch of the hypoglossal nerve. I will tell you later what is the descending branch and what is this structure. This is the loop. Okay, then you can find the structure which enter here, the thyrohyoid membrane. These two structures, thyrohyoid. If you raise this area, this is the thyroid cartilage, this is the hyoid bone. Okay, in between the thyroid cartilage and the hyoid bone, we have this membrane we call the thyrohyoid membrane. This thyrohyoid, can you come close? This membrane, white membrane, we call the thyrohyoid membrane. This membrane which is pierced by the two structure. You can see this two structure. One is the superior laryngeal artery, one is the internal laryngeal nerve. If you pull it here, it is the nerve branch from the vagus nerve. This nerve branch from the vagus nerve. Vagus nerve give the superior laryngeal nerve that is divided into internal laryngeal and the external. Internal laryngeal together with the superior laryngeal vessel which the branch from the superior thyroid artery. Okay, And the external laryngeal nerve, this is the artery, very thin, sometimes it is external and the internal. These two branch from the superior laryngeal nerve, that is a branch of vagus nerve. So they are passing, these are also the content of the carotid triangle. Understand this one? Okay. So again repeat, what are the contents of the carotid triangle?
The carotid shape. The common carotid artery with external and internal branch. Jugular vein.
No, jugular. Internal jugular vein.
Internal
Jugular vein, vagus nerve, common carotid artery, and then its division. And there's division, internal carotid artery, external hypoglossal nerve, and its descending branch. Of the descending branch, look at here. Branch of the hypoglossal nerve through the C1. Okay? And then this C1 join with that of the branch from the C2 and the 3 descending branch. Then they make the loop. You can see this loop. What do you mean by loop? Like loop. Okay, you can see this loop. Okay, then from this loop the branches are coming. Okay, then this branch is going to supply the muscles. That is the infrahyoid muscle. So this whole loop we call as the ansa cervicalis. Ansa cervicalis. This, C1, 2, 3. Okay, C1, 2, 3 make the ansa cervicalis. This ansa cervicalis supply the infrahyoid muscle. Now we will discuss about the infrahyoid muscle.